Thanks, Jennifer, for organizing this session. I think just to share with all the audience that we have been working with various schools in helping them to return to school safely for the students as well as for the teachers. And this is across not only in some of the schools in Malaysia, but also in other countries in Asia Pacific. And today we have two of our subject matter experts, Dr. David Teo as well as Dr. Chan, who can share with the participants here on what we have been advising the other schools in the region and the best practices.
Thanks, David. Thanks. I think I see Roger has joined us. Roger?
Hi, Jennifer.
Hi, Roger.
Hi, everyone. So I was on another call and I couldn't leave it, unfortunately, so I apologise for being a little bit late. But good afternoon, everyone, and thank you, David. David, we know each other quite well.
Yeah.
So we really welcome the opportunity to hear from International SOS in terms of some of the issues and challenges about reopening schools, and I'm sure there'll be some interesting questions that will come up from members who are on this call as well. So we appreciate you offering this to us, and thank you very much for offering your time and with your specialists and expertise to share with us this afternoon.
So I think, Roger, thanks for that. I think we'll try to make it as interactive as possible. So feel free to jump in and ask questions. And hopefully we can also learn from yourself and the other schools on what you have done as well in terms of your BCP in preparing to open the schools. So I think, yeah.
Thanks, David. I think the SOPs for schools have just been shared today. The Ministry has put them on, Ministry of Education has published them on their site. I haven't had a chance to look at them in any detail as yet. I'm not sure if any of my colleagues in other schools have at this point in time, but so they have just been published and released. And I think one of the issues will be for private international schools is to the relevance or the applicability perhaps of some of those SOPs in terms of how we operate our schools, but that will be something that we'll have to find our way with once we have a chance to look through the SOPs in some detail. I know this particular group, the 3 to 18 Education Committee, had spoken about meeting again once we receive the SOPs and perhaps having further discussions with the Private Education Department, a division of the Ministry of Education about those the SOPs, how they may affect private international schools.
I guess without further ado, maybe we'll hand over to Dr. David Teo to start the sharing.
Yes,
thank you very much. Just allow me to share screen. All right, quick introduction about myself, Dr. Chan. All right, so my name is David Teo. I'm a medical doctor by training. Work as occupational health and also in the military for 20 years, doing disasters, hazmat, disaster, infectious disease outbreak, all those things. That's my job. I look after the International SOS delivery in Asia. All right, Dr. Chan is my colleague. Dr. Chan, quick introduction for yourself.
Hi everyone, good afternoon. Thanks for having us. I work closely with Dr. Teo and Mr. David and team. I came from intensive care, emergency medicine background, and of course doing all the cold cases and touching on infectious disease and stuff. I've been spending a lot of time in International SOS doing remote health support, and of course another area of interest is actually looking into how we can assist schools especially during this challenging time to make sure everyone is safe. Yeah.
Thank you. So I will start. So our International SOS involvement for the school is not because of the COVID alone, right? Maybe some of us have heard of us before, like in the school arena. We have been helping schools, international schools particular, like universities, right, polytechnic, etc., right, in terms of their travel, health, and security, right, and even on campus health, right, myself, the co-author in many of these guidelines. So with or without this COVID situation, we are always there working with the schools, right, in Asia Pacific, China, right, Korea, Thailand, Vietnam, right, India, Singapore, Malaysia, Indonesia. Right, COVID situation now, right? So if we talk about SOP, BCP per se, all right, if you want to talk about returning to school, we need to ask ourselves the first question, right? What are the conditions for return to school? Right, return to school can be in USA, can be in Germany, when the cases are still spurting by the thousands, all right? And look at India, right? India now in Asia is now one of the fastest growing in terms of COVID situation, but eventually they need to open. So we need to really ask, what is the condition for return to school? Because all of us are responsible to the parents and the small little students in our schools. So we look at short-term measures and medium-term measures. I will not put long-term here, all right? Because long-term is that probably by next year, when the vaccine is out, right, most of these measures could be reduced, right? In the background, ladies and gentlemen, we must always look at a type of COVID surveillance. Must know what's happening in the world in terms of disease in the world and Malaysia. Right? Fundamental principles. So anyone time, by the way, if you find that you have any query, please stop me. So certain fundamental principles before we start our discussion. One, the COVID virus. Right? We can see from the start from Wuhan, right, China, all the way now to the situation now in South America now. Right? Mitigation and containment effort has been relatively successful in many countries. Right, particularly talking about Malaysia. But please bear in mind, the virus has not disappeared. Right, it has not been eliminated. It can be seen even in countries like Korea and China is still there. It come out as sporadic cluster. So in your planning considerations, please remember this. Now, 80% of the cases in community are mild to asymptomatic. And maybe you can look across your friendly neighbor country called Singapore, right? And government, whether it's wise or not wise, start to do active testing, right, among the migrant workers. We have 300,000 migrant workers. So every 2 days, the figure jumped by 1,000. But the population here, government are not afraid because they know quite clearly these are mild cases. After 21 days, they can get them discharged, right? But they want to make sure the whole working force is all clear. Okay, we also found that Malaysia has clusters, detention center, and please bear in mind, Malaysia has not embarked on mass testing yet. Okay, for COVID measures. Now, to put COVID measure in place, I think all of you understand, you need time and resources to implement. It's not so easy, right? And there's always a risk of a second wave, right? I will talk about second wave later on. So you put measure in place, as the thing is improved, do not remove them straight away, because to put it back takes you a lot of time and resources. The other one on travel, although because of MCO now, the movement control orders and the travel restriction everywhere, I'm saying travel will open. The school will reopen, but even let's say you start school in August, in July, right, September, right, after 2-3 months time, right, you come to end of the school, holiday will come, right, but the COVID has not gone away. What do the parents do, expats do, students do, the teachers do? They will travel again, right? So airlines will operate again, as we know that clearly now. Already they start to consider green lane now, right? Singapore, Malaysia, Singapore, China, Australia, etc. Okay, so COVID vaccine, clearly, right? Most of the companies producing this vaccine, right, are raising ahead. So maybe we think by first or second quarter next year. All right, we're talking about a vaccine that viable to be vaccinating the population. But even we found a vaccine, for it to reach the world population, right, it take you 6 months to a year, right? And depending who get the vaccine first, right, then you politics does comes in, right? Those are not friendly to the country invent the vaccine, may not get the vaccines. Okay. The next thing I'd like to touch on clearly is on this safe distancing. I've spoken to many schools, trust me, and everyone asked me the same question. What is this safety distance? Is it 1 meter, 1.5, 2 meter? All right, and different government give different direction, right? So medically, I just want to share with you, right, between 2 persons, both of them are not wearing masks, right? On the left, you see one person is coughing away, right? The other person, right, is a healthy individual standing close to the person, right? So when a person cough, and we know that COVID till now, the evidence still point towards droplets. When droplets fly up from the person, right? Now droplets do not fly in the sky and move around and follow the wind, and droplets drop to the floor, drop to the ground. So the small droplets will fly to a distance, maybe maximum 5 to 6 feet. That's about 2 meters. So technically, I'm the person on the right, right of the screen. Okay, and if I do not wear a mask, so if I stand 3 meters away, technically I'm quite okay. Right? So but we know that even wearing the mask, like no mask is 100%. Okay, other than the N95 mask. So most government will say that, okay, when you first come out with the rules, that put the distance as 2 meters, and the mask is to reinforce the protection between two individuals. Of course, you know, in a medical practice where you have to deal with patient, because they are protected adequately, the distance can be shortened. Okay, and when schools in Germany open, Europe open, right, they set the distance as 2 meters. That's the social distancing. And indeed, this social distancing work. So many countries, because of social distancing, are seeing the curve being flattened. All right, so this is 2 meters. Now, the other thing quite important to consider condition, when do you reopen the schools? All right, the first point very important are non-negotiable. The national government or regional government must permit the reopening of school. All right, if that's in terms of regulations. But we are saying from International SOS, all right, besides this, right, we want to add one more clause to it, right? To say they should adopt this recommendation we put in place called the 5DMA. Now, since the start of the virus in China, we've been tracking and getting data, right, from China, and now we're collecting thousands of data over the world now, right? And this data help us to do trending, right? At the same time, able to do projection and prediction of the numbers. All right, and we're saying that 5-day moving average, right? I can go a bit more detail later, less than 2%, and in decreasing trend, all right, or the numbers less than 2 digit or less in no company, that will be their condition you should consider going to school. So example, if you look at USA, right, if President Trump decided to reopen the school, all right, 2% in 1 million is 20,000, all right? So even if it's scattered, most of the outbreak you see in major cities, right? If a few thousand that's still breaking out in the city, is it safe to open up the schools? Okay, so versus what I see the numbers in Malaysia now, which is 2 digit, which is a good sign, right? The third point is country medical system must be working and not be overwhelmed. Country must not be any lockdown. Staff contracted to return to work, right? If the teachers and the staff don't come to the schools, the student cannot come back, right? Transport system must be working. Right, we don't assume that even that all the school bus work, parents and fetch the kid to school, your staff, your support staff must still get back to school to work. The border may have to be slightly open or open for expect staff to return with or without 2 weeks isolation, or otherwise the school have to prepare to reopen with just national staff. Right, so what we see in China, many of the schools some have opened, right, with national staff. And every school must have a BCP in place to manage the COVID situation. Now, I call it the BCP X for the school, called XS for extraordinary. Okay, this is from you can't get this diagram from internet. Right? This is our own Internet SOS, our data plotting from the cases when collecting. Right, look to the green graph is North America. Okay, right, just to show you this is what I mean by surveillance in the world. You need to know what's happening in the world. USA, the cases are still growing, right? And this is the highest now in the world, North America now, right? And this is Europe. Europe is flattening out now, right? Okay, Asia is growing slowly, right? Okay, thanks to other countries like India or maybe Singapore contributing to the figures. Like Philippines, they're still growing in numbers, right? Middle East, but look at South America. South America is spiking now, right? It have a slow start, but it's not growing. Brazil is now world number 2. And many of the countries in South America are now booming. We also look at Africa per se. So Africa, the country are growing at a slow rate. Maybe they just came up with Ebola. Maybe there are not enough testing. But this is the figure you see in the world. So what, showing this slide to you, ladies and gentlemen, that have a good view as you plan or you're planning for school, what's happening outside Malaysia. All right. Okay, this is what we say the 5-day moving average. This is using our data plotting, right? And doing projection, right? This is China. Right, so anywhere you see the plotting, when it grow below 3%, right, 3% mark, right, usually what we call it has reached a containment phase. Right, this is again our tracking, and so far our tracking is about 95% accurate in the projection, right? Right, the 1-2% where we are away from the projection, we miss by maybe 1%, but fairly accurate in our data. So once you drop below 3%, right, we say that it's reached containment. And after 14 days, we say that it has stabilized in containment phase. This is China figure. So China has below the 3%, in fact, below the 1% for the past 100 days. This is China. South Korea. Now, South Korea is already 2 months, right? Their figures below the 3% mark. Very stable. Okay. This is Malaysia trending, right? So if you go to internet, you see picture Malaysia continuing to grow. Yes, you see the numbers, right? But actually what's happening here, right? Malaysia is slowing down now, you can see now, right? So the daily moving average, we're talking about 3%, 2%, anyway, hovering 1%, that's good news, right? So if you discontinue, Malaysia is the right time to reopen the schools. So what I'm saying that you're opening the school is not because the government said so, because you are basing on solid medical statistics and background and advice. Right. This is what we do in terms of projection. Right? We tell our company, the clients that we have, tell them what the likely number the next few days in the country. Okay, but of course we also need to track. Why am I showing a lot of this, not yet talking about school, is to tell you the importance of monitoring and surveillance. Now, Philippines was doing very well, right? Philippines, you can see from here. Then suddenly, the last few days went up to 4%, right? The cases blown up, see, right? So that's importance of surveillance, right? So Philippines is not really in the containment yet, right? Their cases are below 3%, come up, below 3% come up, right? So once in a while, it blown up like this way. So that's important that working with us, we can then track all these figures for you and give you the advice. Yanjun, you want to talk about Malaysia?
Thanks, Dr. Teo. So if we look at Malaysia since the country eases some restrictions since 4th of May, we have been doing quite all right. Most of the days, almost all of the days are double digit or new cases. So the Ministry of Health and Department of Statistics has also computed data in a different view, which is we are measuring now number of active cases, meaning those cases who are still being cared for as inpatients in the hospital and they have the chance of infecting others. So when we look back in the past 14 days, the latest data is updated to 2nd June. The country has from many zones, which is in the color of red and yellow in the past, we have now moved on to most of the zones are actually green zones. So till 2nd of June, there's only 2 red zones in Kuala Lumpur Federal Territory, 2 left in Selangor State, and 1 in Negeri Sembilan, which is south of Selangor. So for 41 active cases and above, it will be declared as a red zone. Now, zoning of countries, we have seen it in China as well. It is actually the basis to advise the public and, of course, to assist the government to think about how to further relax certain important things like interstate travel or even border opening. So yesterday and today, we have seen Sabah and Sarawak saying that perhaps quarantine is no longer needed as long as the traveler, but for now, leisure travel is not in the picture yet. For those who are not from Sabah and Sarawak, trying to enter that state for work purpose, for example, as long as ability to show COVID-19 negative up to 72 hours before arrival at the state, then maybe quarantine for 14 days is it's not needed anymore. Next, please.
Thank you, Yanjun. So just a follow on to this, that look, although you have 41 cases, right? Okay, another time with 80 cases. What does that mean? Should I be afraid? Should I start closing the school? I will talk about this later about second wave.
So in a very broad sense, Malaysia is going to advise many sectors, including education sectors and of course other social activities or lifestyle activities based on a few key points. So All this will be heavily advised by the Ministry of Health, looking at the individual level, community level, for example, campus or school, and of course the employer level, like for example, administrative level of a school. Few things will always stick around. One would be maintaining physical distance. Health Ministry is advising no less than 1 meter, wearing a face mask outside home. It's not mandatory, but it's encouraged. Good hand hygiene. And before entering any premise, there should be a temperature check. And when physical distance is not available, then mandatory facial mask is good. Next, please.
Thank
Dr.
you.
Teo, is you.
All right. So I did mention before, return to school, right? We come up with campus health return to school guideline. And like what I said, this is only a guideline, right? It's a recommendation, right? Okay. So what is inside the guideline where we talk about, right? And they talk about two areas. One is midterm, short term, and then midterm, right? Okay. So things like you need to have a COVID crisis committee. You need to have a pandemic officer, right? The one that's coordinating all the effort, deals with the infectious disease, all right? Reporting to the head of school, and also a liaison for the government, all right? For the Ministry of Health. And then when something happens, if the health authority comes in, this is someone also responsible to liaise with them, all right? And in the BCP Acts, right, those things you need to look into will be like things like return groupings. When school reopen, you can't all come back one shot, right? Who should come back first? What's the interval between each group, right? Look at general measures, right? Things like PPE, look at the hygiene, personal hygiene, look at disinfection cleaning, etc. Right? Look at control access, very important, gate access. All this we'll talk about it a bit more detail later on. Training, right? Transport, right? Transportation, right? Whether the hours are staggered, where do the student get off, right? With same point, different point. Look at classes. How do you operate your classes? Will they be same as before? Look at meals, sports, mental health, boarding school if you have, and very important, managing of sick student and staff. Okay, all right, and also look at vulnerable group. Okay, all this we talk about more detail later on. And subsequently, in once the school reopen, right, you really need to look at midterm, right? Medium term objective now, your BCP, you need continuous surveillance, what's happening in the country, right? Okay, so if there's outbreak all happening around school and you do not know what's happening, right, that will be a disaster. And monitor country regulation. Remember, the regulation easing is not permanent. If the cases comes up again, the regulation will tighten again, right? You need to review your BCP. And the important thing, what Dr. Chan has mentioned, COVID testing, right? So a lot of schools in Europe are now doing COVID testing of the teacher. Singapore tested 30,100 of the preschool staff, right? Before they allow the preschool to open. All right, so look at essential travel, and then of course vaccine development, what's happening in the world. Okay. So in terms of BCP that we mentioned earlier, what about which group to come back to the school first, right? If given a choice, you can do the planning. Dr. Chan?
Thanks, Dr. Teo. So we have look around at how other countries are introducing the students back to schools. There's actually different prioritization and further determining what kind of method that we should employ. So for example, say Malaysia, we are quite clear that for the government schools, the year 10 and year 12 equivalent students who will take government exams will, when school does reopen, they will go back first. So if we are looking at countries like Denmark, Norway, or France, the younger children are coming back to school first. Younger children perhaps need more time as well to learn about physical distance and hand hygiene. And in other countries like Germany, older students are actually coming back. And we can also see hybrid method happening in countries like Singapore and Australia. We have the younger ones and the slightly older ones coming back to the school. So of course, we may have seen whereby in some countries, students whose mom and dad or caregivers are actually the frontliners, like the healthcare workers and cops and etc. They probably would also be considered to go back to school first. Yeah, there's no there's no fixed method, but it very much depends on what kind of manpower we have in the school as well in introducing who to come back to school first. So there would be always a group that we probably are not going to let them return to school too soon when it comes to students, because some students may have some underlying medical condition like type 1 diabetes or cancers. Yep, Dr. Teo. So when we look at return intervals, Dr. Teo is going to tell us about the staffs or the faculty first.
Thank you. So on this part, we mentioned that when the economy open, right, when you want to bring back the staff, right, we have a proper guidelines, right? So we look at the disease cases in the country, right? So this is something we call one incubation period is 14 days, right? If your country maybe you have 14 days straight, your cases drop below 3%, all right, okay, or 2%, depending on how you tighten the thing, right? Maybe you want to consider, is it time to consider, right? If you have 1 month straight where the cases are below the number, then start preparing to return to work, right? Most countries open up the economy after about 2 to 3 months, right? 2 to 3 months, you are talking about 4 incubation period, right? Okay, but whatever it is, we're saying that the teachers must always come back earlier than the students, because the teachers, the staff, academic staff, support staff, and the workers because you need to come back earlier to do maintenance of the school facilities, right? You know, prepare the safe distancing, etc. Right? So even when you bring back the staff back to the school, you need to bring them in intervals, right? Starting maybe 50%, 75%, etc. But whatever is always not 100% because the school need to review who among the staff are in the vulnerable group. So I have repeat this again, right? If the vulnerable group contracted COVID virus, all right, of course, the risk is dying is much higher, right? What we see now all over the world, the statistics, right? People 60 years and above, all right, I'll talk a bit more detail later on, right? People have underlying diseases, all right? These are the group that we worry about. So you need to pay attention to this group, right? So regards to when to bring back the children and what the interval, right? Yanjun?
Yeah, maybe I can set the scene a bit. So since easing of restrictions in Malaysia, what we call the Conditional Movement Control Order, it started on the 4th of May. So till date, we actually have done quite well, whereby day-to-day new cases are at low to just close to 100 cases per day in certain days. We are at 2 incubation period plus 4 days because today is day 32. So in 10 days time, we are going to be at 3 incubation period that we have consistently do quite well because local transmission cases is not affecting so much Malaysians per se, but it's more of a controlled situation whereby clusters of foreign workers are being affected. So if we were to look at column number 3. So we are slightly more than 2 incubations period right now. So we are at day 32. Should we think about return to school? Looks like this week we can start thinking about it. So physical distancing, more than 1 meter is what recommended in Malaysia, but 2 meters is really good. We know why, because if we do not wear a mask at 2 meter distance or more, the droplets don't really get to us that effectively. So this week would be thinking, for example, this is just a guide, say we start looking at it. This week we'll be thinking about return to school plan in another 2 weeks time, because 2 weeks is a good time to make sure everything is in place. Perhaps the identified group, call it group 1, and 50% of the staff can start coming back into school vicinity. And perhaps at half an incubation period, meaning every 7 to 14 days, we can then look at whether to introduce more and more groups in priority to return to school. But as always, the vulnerable group, be it students or the staff, would be excluded at each phase just to safeguard them before a vaccine arrives. Next, please.
Thank you. So on. So if we see there's a green and a yellow, what's the difference here, right? So let's say Malaysia is in this category of group 1, right? But there are some countries, say Bangladesh, all right? I will see places like Laos or Cambodia that they are in the second group. Why? It's because the COVID situation before, right? Their health facilities are already not as good as Malaysia. All right. So we have done all those statistics, all those factors. We have labeled them under different category. Now, as we mentioned before, the COVID has not disappeared, right? It's just been suppressed. If there's a resurgence again, right? Those in category 2, right, will fare worse. So in those countries, normally we say that start slower, right? Instead of 50%, start 25%, right? And maybe this doesn't apply to Malaysia. Okay, control. Okay, so I'm not sure. David, do you have a video to show them? David? David?
I'm not sure. You check with Wendy on the line.
Yeah, so essentially what I want to share with you is that gate control is vital. It's very important. All right, so gate control consists of a few areas. One is health declaration, contact history, right? On top of that, there are 2 data you need to capture. One is temperature screen, right? You need to screen the temperature of the person entering the school, maybe teacher or maybe the student. The other one is entrance exit data for the purpose of contact tracing. Right, so of course there are many ways of doing it, right? You can do it what you do before, put 2 persons at the gate there, have a contactless thermometer and pop at the head of every student that comes in, then make them record the time. All right, of course this day and age that is too slow, right? Everything need to go digital, using app, etc. But using app today, right? You need app your entry, entrance, and entry exit data. But of course, I'm not a salesman, right? There are many gadgets in the market. The one on the right, maybe David have a chance to share with you later on, right? This is what we put in place in Singapore and Malaysia, our own office as well now, right? It's just a simple tablet, right? Mounted at the gate there. Okay, as a student walk past it or anyone walk past it, right? You can pick up the face. It has facial recognition. All right, it takes the temperature at the same time, and it will give you a warning you're not wearing a mask. I've tested it in myself a few times, very accurate. Like even the mask, they can pick up who I am, right? And within 3 seconds, 2 seconds, it locked me down already. Okay, but this is again, this is just a recommendation that your gate screening should consider going digital. Right? I'm not selling a product here. General measures. So general measures, right? There are a few measures here. One, of course, is PPE, personal hygiene, social distancing, all those things, right? I want to leave this for discussion later on, right? Because I believe these are already in your VCP. I will spend more time for discussion. Okay. We also look at transportation, right? So transportation is like school bus, all those things, right? Because of staggering of school hours, where should you drop them in the school? Where should you pick them up, right? All this we can discuss later in our discussion. Classroom, Yanjun?
Just going to share a little bit about classroom. So the points to look for is actually in alignment with infection control that we also adopt in a clinical setting like hospitals. So since COVID-19 is going to stay for a while, so at any one point in time, someone who is not showing any symptoms probably is harboring the virus. It's just a matter of time when the symptoms will come. So in that spirit, it is really worth thinking about as much as practicable and possible. One teacher is assigned to one class. For example, say it's a geography teacher needing to teach three classes. Probably class B and C would have to listen to him via online solution or webcam. But class A can always listen to this teacher X at all times. And not only that, some classes do come in a bigger number. For example, say class of 30 on usual days, pre-COVID-19 days. But when school does reopen, perhaps in order to honor physical distancing, the physical class can only be 15 people at any one time. When the classroom is really tiny and we are worried about effective physical distancing, then because teaching is an act where we need to talk. So a mask would again mitigate the risk of droplets transmission should the student is unwell or the teacher is unwell. But then again, anyone who's unwell shouldn't enter the school. And Dr. Teo, can we look into suggested classroom sitting?
Yeah, hold on first. Just to add on something, right? So when you reopen your school, all right, I would suggest the teachers or the school, please test the volume first. When I test the volume, the teachers are wearing a face mask. Maybe some of them are want to be more protected, put on another face shield, right? So your voice projection may not be so good, right? So to reach their end, and the classroom now more dispersed. So you ought to test that whether is it feasible for the teacher, especially those who do not have a loud voice. Can your voice be thrown out because they're wearing a face mask and a face shield? All right. So that should be considered tested. Of course, in some countries else overseas, what they do that because of class size, right? A class of 30, they break into two. So sometimes the teacher have to teach 2 sessions, morning, afternoon. Yanjun?
Yep. Hi. So when it comes to safe distancing, there is a few must-have idea, which is round table, or rather circular pattern of sitting is not recommended because we are facing each other. So the students should always face the back of another student, and the teacher who's imparting knowledge in front of them, then probably the physical distancing is really important, plus the face mask, plus the face shield. Zigzaggy sitting can be considered, but when distance is a problem, then we need to, even though say class of 30 is all attending the class concurrently, 15 will be in the classroom and 15 will be online. Yeah, this just, I think a lot of us may have thought about it. I would like to just share a little bit about sports. So when school does reopen, sports is actually a vital subject, and a lot of students are actually into competitive sports, and they have been missing out on practice for quite a while. Now, competitions and contests probably will return last. So right now we are looking into just by the mere act of going to practice. So we can actually segregate the sports by risk. The low risk one will be those sports that we can do individually. For example, individual running, people who play golf, and no sharing of equipment. Moderate risk will be on and off, there will be some contact and group sports, and high risk will be those things like cheerleading. So it will come back last. Yeah. And now I think we have heard a lot, whether is it in the community, returning to work, or even now returning to school, about vulnerability. Now, it is actually a medical decision or a doctor's input whether someone, be it a staff, a faculty, or a student who may have vulnerability if contracting COVID-19. So we have two color, different hue of yellow color over here. It's because schools are different kind of area. We have a younger group, which is a young student of all ages, and of course teachers of all ages. Now, immunity can be suppressed. For example, the student actually on long-term steroid, actually having childhood malignancy, but in remission. Some of them may have some inborn or metabolism abnormality since birth, so they need to take precaution. And say type 1 diabetes in some children, if we are up to pre-U, then it would be a chronic disease. Teachers or even other contractors in the school will also be having chronic diseases, and of course obesity, and some of them may be in extreme age group. So in Malaysia, the vulnerable age group would be anyone 60 and above, because the data has it, when people do get COVID-19, when age is 60 and above, the possibility of getting into ICU is higher, and of course mortality as well. Yeah.
Thank you, Yanjun. I think time is catching up, right? I'll go a bit faster now. So this talking about resurgence now, right? So we essentially, for us, right, our company actually do look at the country testing capability, healthcare system, and fossil. Most important, we have markers, right? We track markers to show whether the, so in Malaysia, 40, what does that mean, right? So to us, it means a risk level of low risk, right? For a risk for resurgence based on the number. But of course, this is not right time to share with you, right? It is called resurgence risk value. You see over there, right? It's from our computation. So again, it's not something I plucked from the sky. This is based on statistic data that we have computed. Okay, I think this towards the end here, that's to share with you what we can offer to help the school. All right, we can create a mobile bubble, right, for students or teachers or staff who need to travel. We can help you to review your BCP. We can do gate screening support if you need to, supply PPE. We can support the clinics, all right, in terms of medical staffing. Of course, in terms of vulnerable group, you need any advice, we can then provide advice again, right? And some of the schools actually early, when early onset, right, we encounter, they did have COVID cases in the school, where we enter the school as SME to join them in the crisis meeting. We can provide training for pandemic officer. Of course, more important thing, right? Then we can also advise in terms of testing, right? And come next year when people start to travel, even before that, right? Okay, looking at travel again, we can come in and support you. All right, I'll stop here for question. All right, David, you want to take over first?
Thank you, David Teo and Dr. Chan. And I guess open up the floor for questions from the participants. Maybe Roger, any questions from your side after the presentation?
Yes, I expect there will be just a comment I would make. I just find it very interesting that I'm in the vulnerable group, so I feel I'll need to take some time off work, more time when our school reopens. I'm very vulnerable. The comment, just to add a little bit of fun to our session, is I noticed that alpine skiing was in there as one of the sports that's allowed. So I might try and start that one up out at Equine Park as well. We'll try and do some alpine skiing when we reopen. So I think I think probably all of our schools have done some pre-planning and thinking, and some maybe further down the road and others, as to what we're likely to be able to do. I think one of the big concerns we potentially have at the moment is that as to how much flexibility, and I know you can't necessarily answer this, but how much flexibility we might have in terms of which of those models of return of our students phasing in we might like to apply. I mean, ideally, we would like to try and have as many students as we can in our campus, but obviously we know that the physical distancing, that's restricted to the actual physical space and capacity we might have. But I think what's of most interest to me is trying to effectively deliver the curriculum in school while managing physical distancing and the hygiene procedures, particularly the wearing of masks, etc. And I'd just like to know what your thoughts are about using PPE equipment such as the visors versus the masks. We had some discussion about that this morning at our school, and our nurse really indicated that the mask is more effective, obviously, than just having a visor. Although a mask is also more intrusive if you're at the front of a class and you're trying to work with students. What are your thoughts on that?
Thank you for your question. So maybe I'll answer first before I ask Dr. Chan. Now, firstly, you remember the story I told you about someone coughing away and another person who's the receiving end, right? The mask has two purposes. The mask prevents the droplets from flying out from the person who carries the disease as much as you can. When you cough, it is stopped by the mask in front of the person who's coughing, right? Okay, if I wear the mask, it will help to prevent the droplets from coming to me. All right. Okay, but wearing the face shield, all right, remember when you cough, all right, the face shield will catch most of it. Some of them will still drop to the floor under the side. Okay, In addition, all right, the face shield protect the whole face and the eyes. You want to ask the question, why the doctor in the hospital, beside an N95 mask, also wear goggles or face shield? Because eyes also may be the potential areas of entry, all right? And also the face. Once it drop on the face, right? That's why people always talking about don't touch your face, don't touch your face. So the face shield does that function as well. So based on that, we're saying that students should wear face masks, all right? But teacher, because they need to talk, they need to show the face, then the face shield will be good enough. Of course, assuming a teacher as well. All right, Yanjun, anything to add?
Yeah, so Roger, there's a good figure, or rather more encouraging thing is that so when we talk about mitigating risk, the physical distance why should it be the first thing to come? Because through data and study, New England Journal of Medicine actually found that if physical distance can indeed be at 2 meters apart, the risk of transmission of the virus is actually almost cut down to 60%. So when you have that and you add on a surgical 3-ply mask and you add on a visor, I think this is quite safe. It's how much we can do and how comfortable a teacher is teaching with a mask. It's not easy, I think.
Thank you.
If I can add is also there are some schools have done it successfully, like in Taiwan, right? They actually have what you call impervious barrier. Maybe I see on those pictures, right? There are barriers they put between each student. Because of that, they manage to reduce the distance. But again, as I say, right, when reduce the distance using those things, provided the children doesn't walk around the whole place, the smaller kid doesn't behave what you want him to do. So the spacing between smaller kids has to be enforced. But older children, because of using the impervious screen, also in your workplaces, right? And also during meal time when a mask will come out to eat, the impervious screen, right, whether it's a plexiglass or something, will help to reduce your distance.
Yes, I've seen those in place at Kellett School where they have the impervious screen on a desk and they have 2 students. They're not, the students certainly aren't 2 meters apart, but they're wearing a face mask and they have the impervious screen between, so to avoid the transmission or spread of water droplets from one student to another. I'll throw it open to other people who are online. If you want to speak, you could put your hand up, and if you hover down over the reactions button down at the bottom of your screen, you can have a little hand show up on your screen if you've got a question you want to ask. So perhaps mute yourself unless you want to put your hand up and ask a question from the reactions button.
I think, David, you talk about transportation, right? I think almost all schools will be arranging buses, transport for the students. Are there any measures there to be taken?
Yeah, I think firstly, you talk about your school hour in the first place need to be staggered, right? Basically, because of social distancing, right, you can't allow all them to come at one time. And it's also good practice. In fact, all workplaces elsewhere in the world, right, everybody, the government make a very strong guide that you should have staggered hours, right? So because of staggered hours, you really have the student kind of different time, right? That will help to ease at the dropping point, number one. Number two, maybe the school in your BCP need to have a very strong guide for the transport operator, like the school bus operator, right? Should the driver be screened? Number one, should the driver be tested if possible, right? Number three, in the bus, that's a sitting arrangement. Of course, some schools when you open, right, will dictate that you have alternate sitting, right? But based on that, you have a problem, right? Then your frequency of school bus, right? Instead of 1 load, you have 2 load because your student only carrying half capacity, like the aircraft now flying the sky carrying this passenger now. Okay, so these are guidelines you need to enforce. And we normally also advise that then the way they disinfect the transport, the bus, etc. So before carrying student, what time before that you need to clean the bus first using disinfectant and let it air for a minimum of 10 to 15 minutes, right, before you're allowed to carry students. Now, the guidelines a lot, right, including the buses, what do they do in between? We all know that for a fact, many school bus operator, right, because of economic reason, right, David is a businessman, can tell me also, right, after they drop the student, what they do? They'll go and do other jobs, right? So do you allow the school bus, after all the effort you have done, right, went on to carry a group of workers somewhere else, right? So these are all the measures. And then when they come to the school, when the bus stops, the student comes out, right? right? You also do not want them to jam out the whole place. Do you want a more longer space? And school reopen, maybe the parents will help to fetch some of the children as well. Okay, so these are just some guidelines. I'm happy to talk to the whichever school who wants to know more. Thanks, David.
Thanks, David. Any questions from anyone? Any specific questions? David Griffiths, please.
Yeah, hi. Do International SOS have any guidelines for sleeping conditions for boarding schools, as in how many learners they would recommend to share a room? Currently at my school, we have single rooms, we have double rooms, we have triple, and we have quads.
Yeah. Okay, so maybe before I answer the question, right, let's do a simple thing like the gym, right? So we're saying it's 2 meters apart. Maybe I ask the question that if you have to go to the gym and do, what will be the safe distance, right? So using that, we can help to go back to what is the sleeping space, right? In the gym, you're not like in the classroom, you sit down still, right? You have to move around, right? So in the gym, normally most guidelines will put as a 2 meters square, minimum 2 meters square, right? Because you don't expect us to do the gym finish, right? You still walk around and your sweat are flying. Right, but also gym reopening will be maybe in a much later stage, right? So back to the school, right? The boarding school, I'm sorry, right? For accommodation purposes, of course, priority is single room, right? I think single room or two to a room is fine, as long as the two to the room keep themselves to the two to the room, right? That means they are in the same room, they're living there for they don't change the location, right? And 3 or 4 to the room, right? I can't advise that until we know those dimensions. Right, truly, the guy who's sleeping in the room don't just go to the bed and sleep. He will walk around. Okay, so if you say it's the 4 to the room, you're talking about adequate ventilation, right? Adequate space for common activities, right? So if you apply minimum 4 meters square, each one of them 2 to 4 meters square, right, per person, right? I repeat that 2 to 4 meters square per person, right? That'd be very helpful. But again, then if your beds, right, if it is a one up, one double decker bed, right? Okay, but we're talking about the risk. 4%, of course, anyone get infected, the risk is higher, 4 of them. Okay, so like in most dormitory now, you see in Singapore now, right? They are all kicking out all those ideas out now. They reduce it to 2 to 4 meters square of spacing. At the same time, they don't allow double decker bed anymore, right? Because anything happen, the 4 of them, if they are safe, okay, if we spread 4 of them, get hit at the same time. Right, so there's no magic bullet. You need to then maybe, if you allow us to come in, we look at the blueprint, the diagram of the thing, look at ventilation, right? Shower, all those things with you. It's not one single solution. Thanks.
Okay, thanks.
Thank you. Any other questions from any other people that want to be raised? We're getting close to the end of the 1 hour session. Any other questions that people have burning questions on their minds at the moment? Is there anyone who's had a chance to digest the SOPs that have been shared by the Ministry of Education today?
Roger, I don't think it's out yet. We've been checking the website all day and it doesn't seem to be on it.
Roger, we've been told that there'll be an amendment for the private and international schools that will come next week sometime.
It's good that we know everything that's going on, isn't it? So yeah, I'm only going on what I saw in the press today, where they said that they were on the Ministry of Education site, and I saw the minister holding quite a big tome, which was obviously in Bahasa. So yes, you're right. You might be right, Alan, and that would be useful actually if there is, and that we have an amendment and something that we can work from. Any other questions from people that they want to raise with any members of the International SOS before we finish up?
Roger, I think maybe we will just play a very short 30-second video on that face recognition and temperature screener. We just want to share with the committee what's actually available in the market. David, would you like to share?
Is this for temperature checking, is it?
So it is the temperature checking, and it also has facial recognition, so it knows the name of the students that is coming in, And you can set the parameters. For example, if the students is not wearing a mask and you require them to wear a mask when they come to school, it will show non-compliance. Yeah, so this is all. It can be standalone, independent, and if the students doesn't comply with the temperature and the face mask, then there will be a bleep sound, and then somebody can assist the students. Or it can be automated by linking to the turnstile, and if it doesn't comply, then the students will not be able to get access through the turnstile. So that this is something that is currently available in the market. And of course, the data is important. The data will be automatically captured, and the school administrator will be able to check the data and see whether the students' temperature, what time they come in, which will also help to facilitate contact tracing if needed. Yeah.
Thanks, David. Yeah, I think that's quite interesting. I think the way individual schools will do those temperature checks and the screening will very much depend on their physical circumstances, the setup they have, how students arrive. I know at our campuses we're using slightly different approaches at primary and secondary because of the nature of how the children will be dropped off and how we need to manage their arrival at school. But thank you. It's useful to see what's available on the market. Can I just, are there any final questions before we close? Any final questions that people want to raise? Okay, look, can I just say a huge thank you to David and International SOS, to David and Yanjun for all their input today. I think we're always learning a lot. I think we're never stopping to learn about how best we can try and deal with the pandemic and the situation we're facing. Quite a lot of what we do, you know, individual schools is contextual. It does depend on the circumstances we are dealing with, and also the resources we have at our disposal. And I think we've all been waiting very patiently to see what the actual SOPs will be from the ministry, because that also needs to guide our thinking and into what we can communicate and share with our families. I think the other key question on our mind, obviously, is the opening date, and you shared some useful data and statistics as to how that decision might be made. As you know, our academic years tend to finish in end of June or July, so many schools will be finishing very soon. Some might be slightly later, but I think the big question on our mind at the moment is will we be able to open physically on site before we finish our academic year? And I think that's probably the thing that is most on our mind at the moment. So I just want to say again, big thank you on behalf of the institutions, the education institutions here today, David and your team, and also BMCC for helping to facilitate this meeting. We do appreciate it, and it's been very useful to have you share with us. So a big thank you on our behalf. We really do appreciate it.
Yeah, thank you, Roger. And if there are any further questions, you know, you can reach out to us, and we're more than happy to share more details with the committee. Yeah, thank you.
Thank you. Rahazwan, do you want to close it?
Yes, please. On behalf of BMCC, we would like to thank International SOS for organizing this session with us, and the guest speakers, including our committee members who participate today. I think that's all for today. Thank you very much.
Thank you.
Thank you. Okay, thank you,
Bye-bye.
everyone.
Thank you, everyone.
Thank you.
Bye.
Thank
Take
you.
care. Take care.
Bye-bye.